All right, Ed, you all set?
Yep.
All right, go ahead.
Well, welcome everybody. This is our fifth town hall meeting we're doing for the Shenango Forks retirees. My name is Ed Vaughn. I'm the senior partner here at ENV. I have Kristen Wall with me today from ENV. Dawn Curtis is on the call from ENV, and Cindy Wise from Humana. We're going to be going through a PowerPoint presentation which talks about Medicare in general. And we're going to also go through a detailed analysis that we put together that kind of compares the current benefits that we have in place now at Shenango Forks with the options that the district is considering. But before that, I want to do that, I want to just give you guys a brief introduction to who ENV is. ENV Insurance Agency is a 32-year-old employee benefit firm that specializes in employee benefits. We have 40 employees. We currently work with over 1,000 corporate accounts through the Northeast. But more important to you folks, we work with 130 school districts in New York State. So we specialize in school districts. That's all I personally handle and work with is school districts. And so as we go through there, you have a little idea of who we are and some of the experience that we have. Before I get into the PowerPoint that Joe has on the screen, I wanted to just address 3 questions that have come up with all the different retirees that we've talked to and via emails or calls. And the first question is the timing. You know, why are we having this conversation during this national pandemic? And it's a bad timing, and how's this happening? And I don't think anybody would disagree with you regarding the timing. It's unfortunate for all of us in this crazy time that we're all dealing with here. However, you know, life does have to move on, and all school districts have to work on balancing their budget. And even though the budget vote got moved to June, you know, we still have to get our ducks in a row to be ready for the budget. The other concern we have is that we're not sure how much aid we're going to get from New York State. And they're also talking about making mid-year changes on aid. So it's going to be a very difficult year for all schools to really kind of to go through this. And you're not alone in this decision. I'm in the middle of speaking to several schools about these moves with the retirees into these Medicare programs. I know that Canajahari schools are moving their retirees effective 7/1. Madrid-Waddington is moving theirs 7/1. Harpersville just made the move. They went 4/1. Owego also made the move to 4/1. And the soonest that the Shenango Forks could move the retirees, if they decide to go in this direction, would be 7/1. So I want the retirees to understand that this is not something that's going to happen overnight. Nobody's going to get blindsided. We're going through a lot of these town hall meetings, and we've been through several due diligence. We're taking phone calls, you know, from retirees that have personal questions they don't want to talk about on these Zoom meetings. And I just want the retirees to know that the district is not taking this decision lightly. Okay. The second thing is, why are we using a consultant versus talking to the carriers direct? And the answer to that is a few different scenarios. The first thing is not all carriers will talk to clients directly. Some only talk to consultants. The second thing is that the rates that carriers put out are no different whether you use a consultant or not. The rates are the same. The third thing is a carrier can only talk to you about themselves. So Excellus can only talk to you about Excellus. Hartford can only talk to you about Hartford. Humana, Aetna, they can only speak to you about their products. A consultant can talk to you about all the products. We put together an analysis and we talk about the good, the bad, and the ugly about everybody. And that kind of helps people in their decisions as to what program fits for them the best. The last reason, and I think the most important reason, is ENV has a call center. We've got 9 people that work 8 to 5, Monday through Friday, and we're there to be your advocate. We're there to help you. So when a question comes up that you forgot or you don't understand, or you get something in the mail that you don't understand, or claims were paid incorrectly, we're there to help you. If you call our office, you'll get a person, and they will help you walk through whatever. And all the carriers have call centers too. I understand that. But what I found over the years is that people that don't understand insurance get put into what I call the 1-800 shuffle or a black hole. It just doesn't seem to go anyplace. So our call center has been it's been a great benefit for our school districts, and it's been well received by everybody. The third question is if it's too good to be true, it usually is. How can these carriers give us as good or better benefits for less money than we're paying now? And it's with a few reasons. The first thing is people have to understand that currently your healthcare provider is Medicare. It's really not Excellus. Excellus is your secondary coverage. And, Medicare pays 80% of all your claims, but the district is being billed as if they paid 100% of your claim, or excuse me, Excellus paid 100% of your claims. So the retirees are being billed the same rate as the actives, but Medicare is paying 80% of the claims. So it's not a fair rate. The other thing is when people are on the health care under a Medicare plan, they're all converted to singles. So if the single rate is $500, the family rate would be $1,000. Under the Excellus program, if the single rate was $500, the family wouldn't be $1,000, ends up being $1,250. And you can see at the end of the sheet here when we get down through the presentation how your rates work out, and you can see it's 2.5 times. So that's another big difference that in rates. The third thing is that Medicare pays these carriers to provide better benefits and to provide high quality service to all these retirees. Medicare has realized that they cannot manage these claims as good as these large national carriers. So they provide these carriers with subsidies to do that. And we'll talk a little about more of that in a couple minutes. But those are the three big questions that we've kind of gotten through emails and through calls. I want to just address them as we go down through the presentation. We get into our PowerPoint presentation, and really the first thing comes up is Medicare plans. And just so everybody has and understands the same language that I'm speaking today, we talk about Medicare supplemental policies and we talk about Medicare Advantage plans, and what's the difference? And under Medicare supplemental policies, it's just that. Medicare supplemental policies supplement Medicare. Medicare pays first, and then they pay on top. Under a Medicare supplemental policy, you do have to be covered under Part A and B. There's deductibles and coinsurance from Medicare. However, the Medicare sup policies do cover them. Under the Medicare sup, it's a separate Part D program. It's usually separate. It's not included with the program. Under a Medicare sup policy, there's 3 ID cards. There's a Medicare card, a Medicare supplemental card, and a prescription drug card. Under the Medicare supplemental policies, you may have heard in 2020, Medicare made some changes to Plan F. Well, the reason I refer to Plan F, Medicare labels all the different plans, A through, I believe, J, based on the different benefits. We use F because F is what we consider 100% coverage. Everything's paid 100% other than your prescriptions. Effective January 2020, anybody who was 65 prior to 2020 can go to a Plan F and stay on it. Anybody that would turn 65 after January 2020 would no longer be able to go to Plan F. They would go to Plan G. The only difference between Plan F and Plan G is that the Medicare Part B deductible, which is $198 a year, would not be covered. So Medicare is trying to get people to pay a little bit more money out of their pocket on their deductible plans, if that's all you had was Medicare. Under Medicare Advantage plan, Medicare Advantage plans provide Medicare benefits through a private insurance company. It includes the Part A and Part B, and your Part D is also there. So everything's covered under one program. The out-of-pocket costs are broken down and dependent on the type of plans you purchased. So I want people to understand that the district had no interest in providing benefits that were going to be considered less than what we have in place today. Okay, so we had to customize these plans based on your in-force plans today with Excellus. And I mentioned already one ID card for everybody. The third thing I have on here is it says Medicare plans, the network's irrelevant. And what I'm really referring to there is the network is irrelevant when we're comparing it to our in-force Excellus plan. People could kind of, get concerned about, does my doctor participate with this program or this network? You no longer have to be worried about a network. The answer or the question is now, does your provider accept Medicare or do they do Medicare assignment? So that's the question. The nice thing on the next page, we get into these passive network programs, and what that means is as long as your provider accepts Medicare or does Medicare assignment, there should be no issue at all with your provider. The provider does not have to belong to any specific network. And also retirees don't have to worry about doing anything with billing. All the claims are handled and processed through the carrier themselves. I tell people 98% of providers in this country participate with Medicare or Medicare assignment in one shape or a form. In New York State, the 31 counties that Excellus is in, 98% of the providers participate with the Excellus program. However, on a national basis, only 80% of the providers on the national level would participate with a Blue Cross Blue Shield program. So from a national level, there's more providers in Medicare than are on the Blue Cross program. The next thing I talk about is some frequently asked questions. As we do these meetings, a lot of questions come up before we even have these conversations. So I'm just trying to hit them before we get into our presentation. But the first thing is, how is Medicare Advantage different than Medicare Supplemental Policy? And we've already kind of gone through that. But what I want to point out here is that these Medicare Advantage policies, to keep their subsidies where they're at, they've got to provide amazing benefits and amazing service. And they get rated by Medicare, and they have a star rating. And both Aetna and Humana are rated 4.5 out of 5 stars, which is a very good rating. Next question is, will I have to switch a doctor? And as I've already talked about, as long as your provider accepts Medicare and Medicare assignment, you won't have to make any switches. 98% of the providers nationally will accept Medicare in some form. Now, I did talk about earlier, the only time that I ever see an issue with a provider is when it comes to a private contracting physician. Some physicians will say, Ed, pay me $5,000 a year, you'll have 24/7 access to me, sign this contract. Those providers don't accept anybody's coverage, not even the current Excellus program. And if you're on a private contracting physician contract, you'd already know. So I think if there was an issue with a provider, I think retirees would already know what's going on. How are claims processed? Under the Medicare supplemental policy, claims get submitted to Medicare first, and then they get sent to the Medicare Medicare sub policy second, and then they get processed. The Medicare Advantage program, all the claims are submitted right directly to the carrier directly. What tier is my prescription on? Currently, most people at the Shenango Forks School District are on a 210 program, which means they pay $2 for generic drugs and $10 for name brand drugs. Okay, we don't really see any disruption with that because it's simply a generic or a name brand drug. The current carrier that we have now has an open formulary, and the Medicare Advantage plans also have open formulary. And what that means is the formulary is the list of prescriptions that are available to you. And being that it's open, is they don't have any specific restrictions on that formulary, which is a good thing. I do want to talk about tier changes, though, because it is possible, and it does happen on an annual basis, that drugs can change tiers. Drugs do become generic, and they will drop in cost. And sometimes drugs will get tweaked and become more expensive and get added to the name brand category. So what we've been told is that if a drug is going to go down in cost, it can happen whenever it happens, or as often as it needs to happen. If a drug is going to go up in cost, it can only happen once a year in January. The industry standard on that is quarterly. We see tier changes in the industry on a quarterly basis, but when it comes to the Medicare plans, they can only change annually if the copay is going to go up. The next question is, and I'm sure everybody's heard of this, is there a donut hole that we have to be concerned about? And the answer is no. And for those people that don't know what a donut hole is a gap in prescription coverage that happens on individual policies. Okay, so if you know somebody has an individual policy that they bought off a TV, or they bought off a flyer, most likely they've got to deal with a donut hole. On this policy, you will not have to deal with that. Keep in mind, we are not talking about individual policies here. This is a policy that is a group policy that is being customized for your benefits that you currently have at Shenango Forks. Is there a pre-existing condition clause that I need to be concerned about? No. If somebody's being treated for heart conditions, cancer conditions, diabetes, no matter what it is, there is no pre-existing condition clause to be concerned about. What happens if my spouse is over 65 also? If your spouse is over 65, then your spouse will transfer the Medicare plan as well. And keep in mind, what we're talking about today is for retirees that are post 65. If you're under 65 years old, this will not apply to you at this time. What happens if my spouse is under 65 and I'm over 65? So if your spouse is not 65, but you are over 65, you could transfer to the Medicare plan and your spouse would stay on the active plan until they turn 65 and then they would come over. Typically the coverage follows the spouse. Do I need to be enrolled in Part A and Part B? Yes, you do. Just like today, you're on Part A and Part B, you pay for Part B or it gets deducted out of your Social Security check, would be the same thing. What happens if I have questions regarding or questions or problems? So you can see we've got a 1-800 number there. You can call the ENV call center. We've got the ENV call center's email address there. I believe that my phone number and my website are currently on the district's website, and I asked the district today to add my extension. I know a few people have called and unfortunately had to go through our directory, and I forgot to add that. So we have added my actual extension, so it'll be less time for people trying to get a hold of me directly. At the end of our presentation, if anybody has anything specifically that they want to talk about or have addressed, if you send me or if you email me your name and your phone number, I will have Humana and Aetna contact you back to run you through providers or prescriptions or scenarios to let you know how things will be covered. The next page is a list of the districts in Central New York and the Southern Tier that are currently on Medicare plans. So these are districts that I've handled. In full disclosure, the Shenango Valley School District has their teachers did not go on the Medicare plan. Everybody else did. So that's one difference there. And Johnson City, who's not listed here, has also gone to a Medicare plan. They went to Humana approximately 4 years ago. And I don't put these on here other than any other reason to let people know that you guys are not the guinea pigs. This has been a tried and true program that works. And I know I spoke to a retiree in the last meeting who had spoke to a few of these districts. I think it was Shenango Valley, Deposit, Walton, and Johnson City. And the comment he made was it was kind of surprising because each district had a different carrier. And one of the employee or one of the retirees made a comment about paying $20 for a prescription program, which is really what the benefits were. But the point that I wanted to make here is that all these carriers do a great job, and it really comes down to the size of the group and your benefit structure as to what carrier is the best fit. And all these carriers are good carriers. I mean, Excellus is a great carrier. Humana is a great carrier. Aetna is a great carrier. Hartford's a great carrier. They all do a great job. It just comes down to what is the best program for the district. And that's the PowerPoint. Joe's going to put up now the analysis that we did that will, what we've done here is we've broken down the current benefit structure, which is on the left-hand side, your Excellus Classic Blue, which is what most of the people are on today. And to the right of that is the Excellus PPO program. And I believe there are 6 people on that as of today. Then to the right of that, we have what the current Medicare benefits are. To the right of that is the Excellus Medicare supplemental proposal and how the benefits are covered there. And then you'll see some shaded areas. All I've really done here to try to make it easier is to put down a plus sign, an equal sign, or a negative sign to show you whether these benefits were going to be as good or better, or were they less than. And then to the right, I've got Humana, and I've got Aetna, and I've done the same thing there as well. So most of the shades you'll see on your copies, if they're black and white, would be a light gray, and then the negative would be a dark. Also, I want to make sure I mention there have been some upgrades made to the Humana proposal, and I'll go through each of those as they come up. And we did not send out another analysis to people because we didn't want to confuse people. So right now there's only one set of data going out there, so everybody has the same exact data that we're looking at. I did send the district today a chart with all the upgrades that Humana made, and I'll make sure that I mention what those upgrades are here so you can actually write on your analysis what they were. So with that said, let's kind of start going down through this presentation. And again, as I said, please hold questions till the end, and then we'll open them up for everybody to, anybody has any questions, we'll answer them then. So the first thing, as you can see in the first column, under the Classic Blue, there's an individual deductible of $50, and the family deductible is $150. Under the PPO program, there is no deductible. Under Medicare, you can see they've got a deductible for Part A and Part B. It's $1,408 for Part A and $198 for Part B. Under the Excellus Medicare sub plan, the deductibles are covered 100%. So there are no deductibles to be concerned about under the Excellus plan. So the coverage would be as good or better. Under Humana and Aetna, you can also see there are no deductibles to be concerned about. So again, the coverage would be as good or better. Under the standard co-payments, under Blue Cross Blue Shield, there is no co-payments because you're looking at co-insurance. Under the PPO plan, there's a $10 co-payment. So every time you go in for something, you'll be looking at a $10 copay. Under the Excellus Medicare program, there are no co-pays. So the benefit's going to meet the criteria of being as good or better. And under the Humana and Aetna program, there are zero copays, which means when you go in to see a physician or go into a hospital, you see zero copay, you pay nothing. So the benefits are going to be considered as good or better. The next column is standard coinsurance. You'll see 20% in the number. What that means is that you pay 20% and Excellus pays 80% until you've reached an out-of-pocket maximum of $400 for an individual and $1,200 for a family. Under the PPO plan, it wouldn't apply because they're only talking about copays. Under the Excellus program, same thing. You know, there is no coinsurance that's covered 100%, and there is no out-of-pocket maximum because you're going to be dealing with 100% coverages. Under Humana and Aetna, the same thing applies. There are going to be no coinsurances, no deductibles, so it doesn't apply. Lifetime maximums. Under all these programs, the existing programs and the options that the district is considering, they're all unlimited coverage. There is no limitation to the coverage. So it's going to be all the same. The next category is office visits. So the first category, office visit, under the Excellus plan, it's subject to deductible and coinsurance. Under the PPO plan, it's a $10 copay. Under the Excellus plan, the Excellus Medicare sub-plan, you see 100% coverage after Medicare. So it's going to be as good or better than we have in place now. Under Humana and Aetna, you see zero copays. So it's also going to be as good or better. Earlier in the meeting, we had a question, what is the difference between zero copay and 100% after Medicare? And the answer is nothing. They both mean coverage at 100%. It's just the way that the carrier lists how they're covering it. So Excellus would list, we pay 100% after Medicare, and that's the way they want it in the analysis. And then with Humana and Aetna, they say zero copays. So they mean the same thing. Everything's covered 100%. The next category is chiropractic care. Under the Excellus program, you've got subject to deductible and coinsurance, and it covers spinal manipulation only. Under the Excellus PPO plan, it's a $10 copay. Under the Excellus Medicare plan, it covers 100%, but for spinal manipulation only. So it's going to meet the standard of what we have in place currently. Under Humana and Aetna, both plans will cover at a zero copay spinal manipulation, and they also cover routine maintenance care. That's a big added benefit that we don't have in place currently. The next category is preventative health benefits. You can see on the left-hand side, routine physicals, adult immunizations, mammographies, pap smears, prostate cancer screenings, bone density tests. All that's paid in full on both Excellus plans. Under the Excellus Medicare Sup, Humana and Aetna, they're also all paid 100%. Next category is routine vision. Currently not covered under either Blue Cross Blue Shield plan. It's not covered under the Excellus Medicare Sup plan, so it's the same coverage. This is the first update on Humana. Humana is going to cover routine vision exams, just like Aetna, at a zero copay, one annual exam every 12 months. So you can write that in. That is an enhanced benefit from what we have today. Eyewear, frames, lenses, or contacts. Right now, under the Blue Cross plans, they will cover a set of glasses that are prescribed after cataract surgery, and that's the same way that the Excellus Medicare plan works as well, so it's the same coverage. Under Humana and Aetna, Humana is also updated this program, so it should read just like the Aetna does. So you have Medicare covered services, then you have a zero copay for non-Medicare covered services with a $100 allowance every 12 months. So Humana and Aetna are going to give you a $100 allowance towards your glasses. And you can use, because it's an allowance, you can use wherever you want to go and then get reimbursed. That is an enhancement from what we have today. Hearing evaluations. Under the Excellus Classic Blue, it's deductible and coinsurance. Under the PPO plan, it's a $10 copay. Under the Medicare Excellus plan, it's 100% coverage after Medicare, so it's going to be as good or better. And under Humana and under Aetna, it's going to be a zero copay, one annual exam every 12 months for both. So it's also going to be as good or better than what we have in place currently. Hearing aids. Hearing aids are currently not covered under either Excellus plan. They would not be covered under the Excellus Medicare plan as well. They are going to be covered under Humana and Aetna. So another update from Humana. They're going to give you the same allowance as Aetna, $600 every 36 months. So that's another added benefit that you don't have currently. The next pro benefit side is inpatient services. So for inpatient hospitalization, inpatient mental health, and inpatient substance abuse, they're all paid the same. Currently under the Blue Cross Blue Shield plans, they're covered in full 100%. And under the Excellus plan, the Humana plan, and the Aetna plan, they are all covered 100%. The same thing applies to the inpatient physician visits, covered in full under the current Excellus plans, as well as all the options that we're looking at with Excellus, Humana, and Aetna. Next page. Radiation, inpatients, okay. Skilled nursing. Skilled nursing is the next category and is covered in full under the Excellus Classic Blue. Under the PPO program is covered in full up to 120 days. Under the Excellus Medicare program is covered 100% up to 100 days. So that's our first negative. So you'll see that's a darker shaded gray. Now, this is another update that Humana made. Currently, it says zero copay from days 1 to 100, then plan pays 0 after 100 days. That has been changed to say that Humana will pay 100% for unlimited days, just like Aetna does. So it's a zero copay. So currently, it's a dark shaded area, but it has been upgraded to cover 100% with unlimited days. So it meets the as good or better benefits. That was another change. Emergency care. Emergency room currently is paid in full under the Classic Blue plan. Under the Excellus PPO, it's a $50 copay. Under the Excellus Medicare plan, it's 100% coverage after Medicare. Under the Humana and Aetna plan, they are zero copays. And it does say, under Aetna, it says includes worldwide coverage. They all do. We have a column here at the end of the presentation labeled international coverage, which I'll address specifically. But the point is that those benefits are going to be as good or better than what we have in place currently. The urgent care benefit is subject to deductible and coinsurance under the Classic Blue plan. Under the Excellus PPO, it's a $10 copay. Under the Excellus plan, again, you can see it's 100% after Medicare. And you can see with Humana and Aetna, it's a zero copay. So you can start to see a trend here. Under the Excellus Medicare plan, everything's paid 100% after Medicare pays their portion. And under Humana and under Aetna, you can see it's a zero copay situation. Outpatient surgery, currently covered in full under the Classic Blue plan. And under the PPO plan, it's a $10 copay. Under the Excellus Medicare plan, it's 100% coverage after Medicare. And under Humana and Aetna, it's a zero copay. So they are both going to be as good or better than what we have in place. Office surgery, currently deductible and coinsurance with the Classic Blue. It's a $10 copay with the PPO program. Under the Excellus Medicare program, it's 100% coverage after Medicare. With Humana and Aetna, it's a zero copay. So those are all going to be as good or better than what we have currently on that benefit. Diagnostic lab testing, paid in full under the Classic Blue plan. Under the PPO plan, it's a $10 copay. Under the Excellus, you can see it's 100% coverage after Medicare. And under Humana and Aetna, it's a zero copay. Those benefits also are going to match and be as good or better than what we have in place currently. Next benefits are going to be radiation therapy and chemotherapy. Both are currently paid in full from Excellus. On the Classic Blue plan, under the PPO, it's a $10 copay. Under the Excellus Medicare plan, both benefits will be covered 100% after Medicare pays their portion. Under Humana and Aetna, there's zero copays. So again, you can see they're going to be able to be as good or better than what we have in place currently. Outpatient mental health, subject to deductible and coinsurance on the Classic Blue, and under the PPO plan, it's a $10 copay. Under the Excellus Medicare plan, it's 100% coverage after Medicare, and under Humana and Aetna, it's a zero copay. So again, they're going to be as good or better. Alcohol and substance abuse for outpatient, paid in full 60 visits per year. Additional days may be available based on medical necessity. Under the PPO plan, it's covered in full. Under the Excellus Medicare plan, it's 100% coverage after Medicare. And under Humana, it's a zero copay, covered 100%. But there is no limitation on days. So it's as good or better, but you've got the benefit there of not being limited to any days that that's required. Therapies, speech, physical, occupational, pulmonary, cardiac, currently covered under deductible and coinsurance with Excelis. Under the PPO plan, it's a $10 copay. Under the Excelis Medicare plan, it's 100% coverage after Medicare. And under the Humana and Aetna, it's a zero copay. So they're going to be both as good or better. Diabetic supplies and equipment and education currently would be covered deductible and coinsurance under the Classic Blue plan. Under the PPO plan, it's a $10 copay. Under the Excelis Medicare plan, it's again covered 100% after Medicare. And you'll see under Humana and Aetna, it's a zero copay. Under Aetna, it does say include supplies to monitor blood glucose. That would be applied to both Humana and Excelis as well. It's just what they put under that column. Durable medical equipment, subject to deductible and coinsurance under the Classic Blue plan. Under the PPO plan, just a straight 20% coinsurance. Under the Excelis Medicare plan would be 100% coverage after Medicare. Under Humana and Aetna, it's a zero copay. So all those you can see are going to be as good or better than what we have in place now. Prosthetics, currently covered at deductible and coinsurance. No calendar year maximum under the Excelis plan. Under the PPO plan, it's a 20% coinsurance with a $15,000 calendar year max. Under the Excelis Medicare plan, it's 100% coverage after Medicare. Under Humana and Aetna, it's a zero copay, and there is no max. So you're going to see it's going to be as good or better. Home health care, paid in full, 60 visits with an additional 325 additional visits under an enhanced benefits program. Under the PPO program, is covered in full, unlimited visits. Under the Excelis Medicare plan, it's going to be 100% coverage after Medicare, no limitation to days. Same thing with Humana and Aetna. It's going to be a zero copay, no limitation to days. Hospice, paid in full under the Excelis plan up to 210 days. Under the PPO plan, is covered in full, unlimited days. Under the Excelis Medicare plan, it is covered 100% after Medicare. And under the Humana and Aetna program, it's a zero copay with no limitation to days. Dialysis, currently paid in full under both plans. Under the Excelis Medicare plan, it's 100% coverage after Medicare. Under the Humana and Aetna program, there's zero copays, so you can see as good or better coverage there. Next category is acupuncture, currently not covered under either Blue Cross Blue Shield plan. It would not be covered under the Excelis plan. However, acupuncture is covered with a zero copay under both the Humana and Aetna program, so that would be an enhanced benefit than from what we have today. Next category is international coverage. I have TBD on here because we didn't have it from Excelis at that time, but I do know that Excelis will cover international emergencies as any other benefit, so that should not be any issue at all. Under the Excelis Medicare program, the emergencies are covered within a 60-day limit of travel, subject to a $250 deductible and 20% coinsurance with a $50,000 lifetime max benefit. That is a negative. That's not as good as what we have in place now. Under Humana and Aetna, they're going to cover 100% any emergencies outside of the country. So it's going to be equal to what we're doing with Excelis currently. Next category is lifestyle and wellness benefits, which currently Excelis doesn't have those programs in place, and neither does the Excelis Medicare plan. Both Humana and Aetna have the Silver Sneakers program and different rewards programs for retirees. Aetna calls it Resources for Living. There are several programs that these retirees can take advantage of from a discount standpoint, redeeming coupons. The Silver Sneakers by far is the most popular program I've dealt with. Retirees can be part of these gym memberships all up and down the East Coast, and you can join as many gyms as you want, which is nice. So if you're a snowbird, you're up here, 4 months out of the year, and you're down south 8 months out of the year, you can join a few up here and a few down there, and you're good to go. The next category is the prescription side of it. And like I said earlier, under the Classic Blue, we have what we call as a 210 drug card, which means you pay $2 for generic drugs and $10 for name drugs. If you get a 90-day supply, you get a discount, you pay the same copay. There's no annual deductible, and there's no annual out-of-pocket max. Under the 5-15-30, that means you're going to pay $5 for generic, $15 for preferred name brand, and $30 for non-preferred name brand. You can see there is no discount for a 3-month supply. There's no deductible, but they do have an annual out-of-pocket maximum of $3,000 for an individual and $6,000. That means you'd have to spend a lot of copays to get to those numbers. One thing I also want to make sure that I'm clear, because there was a question earlier too. I don't want to confuse people. We are not trying to change your prescription copay. If you are on the classic blue and you're currently at a 210 copay, it'll stay that way. The 51530 only applies to people on the PPO plan, and I believe there are 6 of those people in the district. So don't get confused and don't think we're trying to change your current copay structure, because that's not the case. Under the Excellus Medicare plan, they were able to meet the 210 copay structure with the same advancement for 3-month supply. They did not give us the information for the 51530. We do believe they will be able to meet that. We just have not received it yet from them. I just don't see any reason why they wouldn't do it. And Humana and Aetna were both able to match our prescription drug card programs exactly the way that they are. And you'll see Aetna under the 51530 for 2020, they actually lowered the out-of-pocket maximum from $3,000 to $1,500, only because if we did this at 7/1, there'd only be 5 months left, so they just did it as an additional benefit. You can also see under the Excellus program that the formulary is open under Excellus. It's closed under the PPO, and it's closed under the Excellus Medicare program, and it's open under Humana and Aetna. That just means, like I talked about earlier, it's open formulary. They're not restricting drugs to anybody from that standpoint. Now, the other thing I want to mention here too is, because I know there was an email going around or a thread, it is possible that Medicare is covering your deductible and some of the co-insurances on your program today because they're the secondary coverage. That's fine. That's called COB. It's coordination of benefits. The point I'm trying to make here is that on the right-hand side, even with those deductibles or co-insurance that might be paid with Excellus, you still do not have any diminishment of benefits. And there are still several additional added benefits that you don't have now and several positives. So I just want to make sure I make that a point. It was something that was asked about earlier. The other thing I want to mention here is the district has also said to me that if there are any unforeseen expenses that would be denied that would have been paid under the Excellus plan, the district is willing to self-insure any differences. Now, that is something that is going to have to be negotiated. It has to be talked about, and I don't believe any decisions have been made to this point. I know that Joe has mentioned in all of our meetings that it's something they'll be negotiating with the Teachers Association and certain NICET members and Chris Wilkinson. So they have made that comment, and it is something that has to be negotiated and will be announced, I guess, as they get to the final stages. The last section on this, it talks about the actual rates, and I think this has been eye-opening for a lot of retirees because they know what they pay for coverage, but I don't think they realize how much money the district pays. On the left-hand side, you will see under the classic blue, the single rate is $813.92. That's a monthly gross rate that the school district pays Excellus every month for every single person on the plan. Under the family, it's $2,035.97 per person per month on a gross basis. The PPO is $759.85 for single and $1,885.81 for family. When you look at the Excellus Medicare program, their rate is $489.54 per person. So if you're a family, husband and wife, you would pay 2 times the $489.54. The rate under the Humana program for the 210 program would be $305.19, and for the 515.30 would be $251.64. You can see under the Aetna program, the monthly gross rate would be $369.19 for the 210 program, and for the 515.30, $337.78. So when you look at the bottom line, the savings from Aetna is about $1.9 million a year. The savings from Humana is $2.1 million a year, and the savings from Excellus is $1.5 million a year. I do want to point out, remember, we have done some updates on Humana, so those rates will change slightly. We should have those finalized rates to the district very soon. I do not anticipate the rates changing that much to really make any major impact in our analysis here. The other question that got brought up from the district too, from somebody was, is this considered a short-term fix, a long-term fix? How do we know, this is not going to come back and we're going to be in the same position in 2 years from now? So what I did was I took the Humana rates and I raised them 9% every year, and they didn't equal the Excellus rates that we currently have until the year 2031. If I then take the same increase at 9% with Humana, but then now increase the Excellus rates by 5%, which is also very conservative, at 2031 or in the year 2031, there is still a substantial difference. So the answer to that question is this is not a Band-Aid approach or a short-term fix. It's a long-term fix. Any of the school districts that we have put to a Medicare program are still on them. Not one district that I work with has ever come off it that's gone on. But I want to just make sure that people know this is definitely a long-term solution. The other thing I took the privilege of doing is I don't know what different bargaining units pay. So I don't know, you pay 5, 10, 15, 20. I've talked to a few retirees and I know a couple were paying right around 15%. If I take that 15% number from the Excellus that we're currently paying, that would mean that a retiree would spend $1,465 per year for that coverage. And if you're a family member, you would pay $3,663 per year. That same 15% under Humana would be $549 a year and $1,098 a year for family. That's a savings of approximately $900 a year for single and approximately $2,500 a year for family. That's a big savings. Then another question that got brought up was, well, okay, so the gross number, Ed, that you have on this analysis includes the money that the retirees will save as well. So what's the real savings to the district versus the retirees? And the answer to that is most of it. The district pays most of the premium and most of the savings would go to them. So for using that example of 15%, and I know it's not the case, but if all the retirees paid 15% and I took that out of the savings, that would come to about $300,000 and the district would still be saving $1.8 million. So as you can see, the retirees do save a lot of money, but the district is going to save a majority of this savings. Now that is the entire analysis, and that's a lot of information in a very short period of time. And so what we can do now is open it up for questions, and we'll go from there.
Anyone have any questions?
Yeah, Lou Schlechter here.
Yep, go ahead.
So my mother-in-law asked me to attend this meeting. Her husband was a employee of Shenango Forks for many years. Anyhow, so we're sitting in on this meeting, and I guess I know this is a very basic question, but looking at the chart, which policies are going to be going away and which ones are we keeping going forward? So is the Excellus CB going away, or is that going to still be available?
Well, the Excellus Classic Blue would be replaced by one of the Medicare options, whether it be Humana, Aetna, or even Excellus. So any retiree that's post 65 that would be on the Classic Blue plan or the PPO plan would then receive the coverage for whatever the new program the district would choose if they decide to go down that road.
Okay, so in summary, I guess, and it looks going forward, it looks like there's going to be an Excellus supplemental plan. It looks like there's going to be a Humana and an Aetna Advantage plan. Is that correct?
No, there wouldn't be 3 plans. The district will choose one. There's been no final decision at this point on which one it is. I think there was a question somebody asked me yesterday. The retiree, do I have to pick which plan I want? The answer is no. The district will pick which plan they want to use for the district.
Okay, I see. So at this point today, there is no supplemental plan available today.
That's correct.
Okay. One more question. If the district does decide to go with an Excellus supplemental plan, does that have an advantage over the Advantage plans in that you can select any hospital in this country to get treatment versus in-network under an Advantage plan?
I couldn't hear the question, Joe.
Oh, I'm sorry.
Can you hear me
now? Can you hear me now? Or?
I can hear you now. Yeah.
Okay. So very simply, if the district decides.
No, I can't.
Okay. I'm sorry. I'll call in.
No, I can hear. Can everyone else hear? Ed, I think it may be on your end.
Yeah, I heard it. Do you want me to repeat the question?
Yeah. So under the.
I think he's going to call in because he was breaking up.
Yeah, Ed, I think it's on your end though. Kristen heard it. I heard it. Kristen, can you repeat the question so he doesn't have to call in?
Sure. What he's asking, Ed, is if the district decided to go with the Medicare supplement plan through Excelis, would there be an advantage with providers with that plan over the Medicare Advantage plans with Aetna and Humana?
Yeah, no, that's a good question. The answer is no. There is no advantage from a provider standpoint because, again, it comes down to does a provider participate with Medicare or Medicare assignment? So there is no advantage from a provider standpoint over from Excelis to the Medicare Advantage plans.
So if I had chose to go to Cleveland Clinic or the Mayo Clinic for a particular ailment, that would be covered under all three plans.
Yes.
Okay.
Hey, Ed, can I jump in here?
Yep.
Okay, this is Cindy Wise. I'm with Humana. You may run into a physician every once in a while, and because you said the Mayo Clinic, I thought I pointed out. The Mayo Clinic, the big one in, is it Minneapolis? They have a contract with all the, well, several. I know they have a contract with us for services. There's one in Scottsdale, Arizona, though, that will not see any Medicare Advantage plan. Aetna, Humana, United, anybody. So from a provider standpoint, and I don't know what their viewpoint is on any other carriers, but Ed, you had said that the Excelis plan is not necessarily contracted with every provider in the country. The same thing is for an Advantage plan. We kind of estimate that there's maybe 1% to 2% of providers that say, no, we're not going to see you. Majority of the time, the providers are either going to bill the member and then you send it into the plan and we adjudicate it from there. Or like I said, you could run into somebody who's retired that doesn't do any billing at all for any carrier. So there's some odd ones out there.
Right. So the main point is you need to just verify that wherever you're going to go, whether it be a provider or a hospital, that they participate with Medicare or do Medicare assignment.
Yeah, so I think that's the basic answers. If they participate in Medicare, they will probably accept you as a patient.
Probably. And I'd always like to I just always like to be sure of everything, but if you could send Ed your telephone number and name, or else your mother-in-law's, and I think either carrier would be pleased to check out each of those providers.
Okay, thank you very much. And I just want, I'm sorry to, one final question. What are the next steps in this process here?
As far as the school district, sir?
Yes.
The school board would have to give me, the superintendent, the right to negotiate with the CFTA if they decide that they want to go ahead with one of the plans. I would start my negotiations with the CFTA. That would be the next step to get that negotiated. Then there's two other units, the admin unit and the secretarial unit. Would also have to have negotiations. And then once that's settled, we go back to the school board for a final vote.
And once that's completed, then we'll be notified on what the decision was.
That's correct. And if everything went smooth and all units were okay, your new coverage will start on 7/1/2020.
Okay, thank you.
Yeah, Sally.
Mom, you said that Blue Cross covers 80% nationally, 98% in New York. Humana, what percent nationally and statewide are they, and the same with Aetna?
Because they're Medicare Advantage plans, it's going to be 98%. So because 98% of the providers in the country are either accepting Medicare or do Medicare assignment, it would be 98% from a national standpoint.
Thank you.
Hello.
Yes.
Hi, this is Alan Peters for Gail and Alan Peters. Can you hear me?
Yep.
Oh, good. I had a couple of questions. First, on the Medicare contribution. Most of us, or a lot of us, have it deducted from our Social Security. So will that continue with being reimbursed on July 1st of the following year for the Medicare portion?
Yeah, the Medicare Part B shouldn't change at all.
Okay, I know the rates won't change, but right now the school district reimburses us in June.
Okay, and I'm assuming it would continue.
Yeah, that would continue.
Yep.
Okay.
We had that question yesterday too.
Okay, and transportation, like I don't see anything specific in there. I might have missed it, but if you need an ambulance or you have to move from one hospital to another, which I've actually had to do a few times, which is pretty expensive. Is that all covered?
Then do you want to cover that?
Cindy, you're muted.
Yeah,
Yep.
sorry, I'm not fast. Yes, transportation, well, let me say, medically necessary transportation is covered. So if your condition warrants that you have to have medical care from one facility to another, then it would be covered. If it
And
was
who-
and I don't know why you would, but if it was a convenience factor, it wouldn't be.
No, but who determines whether it's medically necessary? The doctors? or-
Medicare guidelines. The Medicare guidelines would apply. Do you
But
recall when you
Cindy-
were,
Cindy, that'd be true to our current plan too, though, wouldn't it?
Yes.
I was wondering if you could tell us if you knew how it was covered when you had it recently, whenever you had it done before. Do you know how it was covered?
I think Excellus paid for it. I could look it up, but they paid for it, not Medicare.
Okay,
Right. I'm typically, I would think that they're going to go by the Excellus, or Excellus is going to go by the Medicare guidelines as well. And if it was medically necessary, I don't think people take routine rides in ambulances. So, but they do go by Medicare guidelines, and probably a person that is a case manager that will review notes as well. So they look at all that stuff.
Okay. And I, I know you talked about travel internationally, which that sounded good. But within the United States, when we're not quarantined, a lot of us travel around. So what should we be checking on for in network or out of network in the different?
You don't need to be concerned about in or out of network. Unlike with Blue Cross Blue Shield, what you have to be concerned about is you have the blue card that travels with you across the country. And so you want to use a provider that participates with Blue Cross Blue Shield. Under any of the Medicare plans, as long as a provider accepts Medicare as Medicare assignment, you shouldn't have any issue at all. So that blue card on a national level covers 80% of the providers around the country, according to Excellus. Under the Medicare plans, it's 98%. So you're going to have more providers to choose from than you have currently.
Okay. And under Blue Cross Blue Shield Excellus, and you seem to say that the star rating was important. What's Excellus's
I
star
cut out on
rating?
that one too, Joe.
What's that?
Star rating.
What is Excellus's star rating, and why is that?
Excellus, under the Medicare supplemental policies, I don't believe they star rate those. I think they're star rating only the Medicare Advantage plans. So there is no star rating, but Excellus themselves is a top rated company.
Okay. And I did look up some things on Humana. To go on the internet and see the different plans, it's confusing because they only show 3 plans, and that's not what this is. I guess
No, it's very difficult to go online and try to figure out what Humana or Aetna is, because this plan was completely customized for your benefit structure. So it's kind of hard to go on there to look at what you might be looking at.
Okay. I did see when I went online that Humana, regarding the coronavirus, they're going to cover anything to do with testing or anything. Hopefully it's gone by, if you do this by July 1st. But will that be part of the plan?
Also on Humana, should someone have the coronavirus, any hospitalization or services, there will be no charge for the individual member. Humana announced Monday that we'll be eating all that.
Okay, good.
Absorbing all that, that would be a better word.
All right, thanks. And I know you've probably been getting a lot of questions. I know you've been getting questions, but we submitted some over a week ago, and we don't have a response yet. We had
Actually,
a couple.
I just emailed Kristen a second ago and said I'm going to call your wife as soon as we're done with this
Okay.
this next call. So you'll expect a call here in a few minutes.
All right, thanks. And then, because there is one example where Excellus paid, we have a personal example where Excellus is paying $4,000 a month for several years, but Medicare didn't cover it. It was a test program that we were approved for. So,
Right.
that's one I want to make sure is covered. So anything else? Nope, that's I appreciate the call. And thanks.
Hey, I would like to touch base on one thing that you said about travel, just to expand a little bit. And should you be traveling somewhere else in the country, and emergencies are going to be covered. So if you, fall and have broken something, that's going to be covered, and that's easy. If you were traveling and you were going to be gone for a month and you,
Oh, I lost you.
Yeah, she froze on us.
Cindy, you
Hello?
froze on us.
Yeah.
get an allergy test, call us and we can call the provider for you.
Yep, I didn't
Oh, did
hear.
I cut off?
Yeah, you cut
Yeah, you
off.
cut off,
Cindy.
Cindy.
Okay, can you hear me okay now? I
Yes.
have unstable internet service right now.
I heard that.
So I think he's gonna send his
So,
name and number. And are you already working with them, Cindy?
Yes, I am. I'm already working with Gail, so I'll
Okay.
call you as soon as this is done.
Okay,
All right,
good.
thanks.
Okay, thanks.
Thanks very much.
Sorry.
Do we have other questions? Okay, there's no other questions. Remember, the next town hall meeting is going to be at 7 p.m. tonight. All information is on the webpage again. In the meantime, if you have questions, please call and or email Ed, and he will get back to you as soon as he can.
Joe, is it 7 or 6 p.m. tonight?
It's 7,
7.
Mrs. Pronto. We changed it for the board meeting because the board meeting's at 5:30, so it should be over open session by 7. So if
Okay,
he wants to go to the board meeting and then to the town hall meeting, they should be able to.
perfect.
Okay, guys, have a good day. Thank you.
Thanks.
Have a good day.